Hi everyone, my name is Dinesh Surasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I want to share with you some of the tips that I've learned along the way and how to optimize your imaging and do your procedures. Today we're going to be talking about indications and contraindications for ultrasound-guided interventions. So let's think about the indications for any ultrasound-guided intervention. Broadly speaking, we can consider it as either a diagnostic or for therapeutic purposes. And this is how I really approach it when I'm speaking to patients, and it helps them understand the purpose of why we're doing an intervention. So let's think about from a diagnostic perspective. Why are we trying to use the ultrasound injection for diagnosis? Well, an example is if the patient is experiencing pain. We can use the local anesthetic that's included in an injection to reduce the pain symptoms. And in doing so, if we identify the location of the pain, then the ultrasound injection is helping us with the diagnosis. Because we can guide it to a particular anatomical spot, the clinician therefore can take it that having performed the injection into that area, this is where the symptoms are coming from. From a therapeutic perspective, it depends on where the symptoms are, what the underlying pathology is, and what the limitations that are imposed on the patient. Consequently, you may decide to choose any number of these different treatment options. And the aim of it is really, again, when you're discussing with the patient, to reduce their symptoms, to improve their function, and to have any other beneficial effects that you may be considering, such as with an anti-inflammatory effect with steroid or a healing effect with prototherapy or PRP. Some of you may recognize this from one of my previous videos, and I have it here again to reiterate the points that when you're discussing with the patient about the reason and the purpose of the injection, it's useful to talk about the type of injection, the main purpose, the onset, the typical duration, and any post-injection advice that you may be giving to them. And it's useful here to see how things like steroid, hyaluronic acid, PRP, prototherapy, and high volume injections have similar yet different purposes. Let's think about some of the contraindications when it comes to doing an ultrasound-guided intervention. To make it easier when you're discussing it with patients, it's useful to consider it as either relative or absolute contraindications to any type of procedure. So let's deal with the relative and absolute contraindications in a little bit more detail. In terms of the relative, the patient may have had a significant flare-up from a previous procedure, or they may have had a procedure that wasn't as effective as we hoped it would be. In both situations, it's important to counsel the patient accordingly. There may be metal or implants in and around the injection site, or the patient may be on anticoagulants or have a bleeding disorder, and so it's important to proceed with caution. If they've had a recent infection or vaccination, such as the COVID vaccine, treatments may interfere with this and vice versa. And similarly, if they're on immunosuppressant therapy, it may interfere with the healing or the outcomes of the procedure. In terms of absolute, to me there's really only three. If they've had an allergy to the medication, in which case it's a complete no-go for the treatment. If they have an active infection around the injection site itself, or if the patient has had an acute systemic infection either recently or if they're currently having something, then it's a real no-go for the treatment. I hope you found this video useful and it adds to your knowledge of ultrasound and how it can be applied in your clinical practice. Please, if you did, remember to like the video down below, and please subscribe to the channel for further updates. I hope to see you all very soon in the next video. Take care.